Thank you all for joining me once again as we celebrate National Hispanic Heritage Month. So it is set for September 15th and is celebrated until October 15th. And this was actually developed initially as a commemorative week back in 1968 because there was a California congressman by the name of George E. Brown who represented East LA and the majority of the San Gabriel Valley. And that area of LA, the greater LA area, he had a large number of Hispanic and Latino constituents, and he recognized the work that they did, particularly around the civil rights movement and the significant contributions that they made. That was then taken to Congress to where it was adopted as a week by President Lyndon B. Johnson. And then in 1987, there was a California U.S. Representative, Esteban Torres, who actually proposed making this into a month from a week because of the significant contributions of Hispanic Americans. While that wasn't passed in Congress, a year later in 1988, Illinois Senator Paul Simon proposed a similar bill, and that was accepted and passed in Congress. So since 1988, National Hispanic Heritage Month has been celebrated month long. So you're like, well, why does it start in the middle of the month? Well, it's to commemorate the independence anniversaries for Costa Rica, El Salvador, Honduras, Guatemala, and Nicaragua, which was September 15th. Mexico celebrates their independence on September 16th. Chile celebrates their independence on September 18th, and Belize celebrates their independence on September 21st. So they wanted to start on the 15th and again commemorate the entire month for the great contributions that those of Hispanic ethnicity have contributed not only to America, but really to society. And that's something worthwhile of celebrating. We also recognize that the Hispanic ethnicity is the only ethnicity that the US counts and tracks, but it covers well over 20 countries in the Caribbean. That includes Central South America, those from Spain, as well as Mexican descent as well. As you can imagine, there's a lot of heterogeneity within the Hispanic ethnicity because it spans multiple races. So as we talk about things today, we don't want to stereotype because there are so many countries and cultures that are represented, but we want to honor all of that as we have a discussion on National Hispanic Heritage Month. So with that, I am so excited to have two PA educators join me today in this conversation. And so I'm going to allow them to tell you a little bit more about themselves. And so I'll start with Dr. Brenda Diaz.
Well, thank you so much for sharing that with us and for your invitation. It's really a joy to be here. My name is Brenda Diaz. I have been a board certified licensed PA for 32 years. I've had the blessing and the honor to serve primarily migrant families who come to work in the agricultural industry in both Florida and Texas. I practiced full-time for a little over 20 years, and then I transitioned to full-time academia in 2009. It has been just as rewarding as my clinical career. My specialty is family medicine and pediatrics. I am a proud graduate of the Harlem Hospital Physician Assistant Program in New York City. I also completed a master's degree at A.T. Still University, and I did my doctoral degree at the University of Lynchburg with an educational track concentration. My journey has spanned several states, and I have worked with families from all different countries in Latin America and the Caribbean. And as you said in your introduction, we are not a monolithic group. We are a very diverse group with a diversity not just in our appearance, but in our language, in our culture, music, even our definition of health and what health is and what good health means. So as a clinician, it is important for us to understand and know where our patients are coming from, or what is their definition of health, and what are their customs. And I'm sure in our conversation we'll be able to expound on that. But thank you so much for having me.
Yes, absolutely. And next we have Dr. Damien Bedoya.
Thank you, and I agree with everything you said. I'm an emergency medicine physician. I was born in Puerto Rico and went to medical school down in Puerto Rico. But I lived in Georgia for the last 15 years. For the last 5 years, I've been part of the Mercer PA program here in Atlanta. As a PA educator, I divide my time between the clinic, the emergency room, and here in the PA school. And yeah, it's an honor to be here, and very interesting to be talking about Hispanic heritage and how that affects and influences what we do.
Absolutely. So thank you both for joining me for this conversation. And I'm just going to start with this question. Why is Hispanic Heritage Month significant to you? And Brenda, I'll have you start us off.
Oh, sure. Hispanic Heritage Month is probably one of my favorite times of the year as an educator, because it really allows me to highlight the beauty of our cultural, and especially our different cultures as a group, but also to bring to the classroom the different health disparities and health needs of our different cultures. Generally, when I do that in a classroom, I go regionally to try to encompass the different groups of Latinos on the West Coast and the Southwest, Southeast, Northeast, and Midwest, because they're very unique and their needs are very unique. The disparities are unique and different. So it really allows me to bring it to the forefront, but not just in the classroom, but also as an educator and as an advocate for our communities. I've had the opportunity to speak with our representatives, our local and national representatives, to bring forth and what our current needs are and how we can solve those needs. As a Latina, it's a joy to celebrate our culture, but also as an educator to bring these things to the forefront and highlight them. And challenge our students to come up with viable, solutions to different issues.
All right, thank you for that. Damien, I'll pop it over to you.
Well, I think anytime I have, or we as a community, the Hispanic community has the opportunity to focus the attention on our issues, it's a great time, right? There's a lot of competition for screen time, air time. So to have a concerted effort from the community to highlight the positive things that we can bring, that our culture brings, it's a great thing. On top of that, at a personal level, I have 2 young daughters, right? And they consider themselves Georgian. They were born in, if you asked me when I was younger, if I was gonna have 2 little young Georgians, it's so unique. And for example, this month, they at their school, they've been learning about different cultures in Latin America. They've been talking about Puerto Rico more. They've been eating the food from different places.
Mhm.
It just fills my heart with joy, right? Like it's
Yeah.
just great. So any opportunity to highlight diversity in our culture, it's a welcome opportunity.
Nice, nice. All righty. So along your journey and your path into medicine, were there some specific Hispanic PAs or physicians that really influenced you, or to go into your professions, or even were there to assist you, give you encouragement along your path? And Damien, I'll start with you.
That's an interesting question. There's so many, and I think as a young physician, I wasn't as aware of the influence that a lot of people were having on me, right? That they were doing a lot of work quietly without just doing a lot to kind of see the foundations for my career. As a physician now, 15 years from graduation, I honestly say that, first of all, anyone that stays in Puerto Rico to do medicine is a hero to me, because there's very difficult work circumstances down there. And having moved here a long time ago, and now looking back, it's just admirable what they're doing. Not only the physicians down there, now we have a new profession. We have the PAs doing the same thing, which is incredible. You're building a profession in Puerto Rico from zero under very tough circumstances. So all that group of people that I could go down the list, but I won't, are incredibly inspiring to me, because they see the potential of the good things that can be done in the island, and to have that foresight and be able to look down the line, maybe not 1 year, 2 years, but look down 10 years and be willing to put the work in now is admirable.
Awesome. Brenda, I'll pitch that question to you as well.
No, thank you. My journey is a little bit different as a Latino woman. Back in the 80s, there weren't very many minority women in our profession, and very few Hispanics, especially in positions of leadership. So having that said, I have made a purpose to be intentional on mentoring early career clinicians, PAs, women, minority women, but also in academia as well. Because I didn't have that one role model that I could look up to as a Latina woman in a position of leadership. But I will like to mention Frank Ambris. He is the program director at University of South Texas, Rio Grande Valley. He's been a long-time educator. And when I was working in Texas, I was a preceptor for his program. And Frank has been a solid column in PA education. You know, he's led his program through some very difficult times, and I always look to him as an example of perseverance, and I in turn hope to continue to be a person that early career educators would look up to, and you know, I can come beside them and undergird them, and just be a voice, a guide, because unfortunately I did not have that, but I'm being very intentional about it. I have been intentional about it, and I encourage those who are watching this recording to do so the same way, and let's collectively be a bit more intentional regarding the mentorship of our minority colleagues.
Absolutely. And so this is a good segue because something that you said kind of struck me. Share with PA educators why it's important to have representation in the program, not only for students, but even for fellow colleagues. Like, because you said, you know, when you were training, there weren't many, and particularly in leadership roles. And so why is representation so important?
Well, as clinicians, we're called to serve. We're serving the community. And our community is diverse. And it's important for to bring that to the classroom, to show the diverse faces of our community through those who are educating, you know, have women and men of different backgrounds, ethnicity, disadvantaged backgrounds, and to have that representation and see those faces, so that when they go to their clinical rotations, when they go and start practicing, it's not so foreign to them, and that because they've had that exposure, whether be it in the classroom or on their clinical rotations. It is important because it's important for them to have be cognizant of the idiosyncrasies of each one of our communities, you know, their difficulties, their challenges in access to care, and also quality care, not just the access to the care, but the quality of care. So that to me is what is most important, and why diversity and why representation matters in terms of as an educator, but also in our colleagues in the department as a faculty. It's important for us to have representation in our departments and have a seat at the table and have a voice, because our colleagues that come from diverse backgrounds come in with certain, you know, needs, and we need to be cognizant of those needs and be able to meet those needs so they can be set up for success. You know, it helps them with promotion and attaining tenure, and to recognize those efforts of scholarship. So having representation in terms of our instruction to students is important, but having representation in the department as educators within the institution is just as important.
Absolutely, absolutely. Damien, anything to add to that?
Well, I think I agree with everything, and I think that it's like fertile soil. Diversity just creates fertile soil for great ideas, collaboration, different perspectives, different ways of solving things. I've seen it here. Like this, you don't have to do any effort that's done towards diversity creates down the line many positive things. We just had started a Spanish club here at Mercer, you know, and you see out of 70 students, 35 students joined Spanish club. Most of them haven't had experience with Spanish, and I think that comes from a concerted effort of including diversity in everything that we do, and it just kind of snowballs into these projects that many of them are led by the students themselves. And that gives you a lot of hope. And it makes you very, very positive to see that the little things that you're trying to do kind of become bigger and bigger and bigger. So yeah, I think we need to, as a program and as a profession, value diversity.
Mm-hmm.
Absolutely, absolutely. Thank you for that, because I went a little off script, but I couldn't help myself.
It's all right.
Awesome. All right, so we're going to shift. You know, speaking of representation, speaking of, teaching students, fellow colleagues, about various health concerns within the Hispanic community, which, as we've noted, is not monolithic. It is very diverse within itself, right? So are there some specific health concerns, maybe specific to a certain community, or some general common health concerns that you've seen within the Hispanic community that we should be mindful of, and we should make sure that we're teaching our students about to be thoughtful of as they're going out and practicing in communities across the country? And anyone can hop in and comment. I won't pick this.
Well, I think, and again, this is a conversation that we've had a lot during some of those Spanish Club meetings. Just being open, to understanding that the Hispanic community is a very diverse community within itself. You need to start there with that openness to what works with one community might not work with another. The other thing, language it's a big part, and we do talk a lot about that. The efforts to connect with someone in their own language, it's felt deeply. I felt it myself as a patient. It creates trust almost immediately, which at the end of the day, it's what we're trying to do when we are there at the bedside, right? Like that's the key to everything we do, that the patient trusts us and opens up to us. And then we can go on and on. And I know a lot about Puerto Ricans. That's my specialty. But yeah, just enjoying that process of being open to different types of communication. I think it's we're at its core. It's very, very important.
Yeah, absolutely. Understanding the importance of being able to communicate in the language, and understand as diverse as our cultural backgrounds is, also our language is different. There are different dialects, they're different, and what means one thing in one culture in Spanish may mean something else in another culture in Spanish. So understand the community that you are serving, and what a fever is in our Mexican American culture versus our Caribbean culture, and what is understood by that, and understand those differences. And only until you get immersed in that, until you and ask what is the difference, and ask, well, what exactly do you mean by this? And that way you can better communicate with your patients. Health literacy is a huge part of cultural understanding. So when you give something in writing in Spanish to someone, don't assume that they will understand what is written just because they speak Spanish. So just make sure that they understand. And sometimes pictures are worth way more than something written in sentences or in words. Just in your efforts in communicating with your community is huge. In terms of pathologies, it all depends on which community do you work with. There are certain communities in our Hispanic, the asthma, for instance, is huge. And there has been some genetic connection, specifically with Caribbean Hispanics and specific with Puerto Rican Hispanic heritage. There is a genetic mutation that is associated with eosinophilic asthma. So, to understand those small, why are we seeing such high prevalence of asthma in Puerto Rican communities as compared to other communities. As a provider for migrant communities, this trauma is workforce. You know, what do they do for a living, and seeing how can we prevent eye injuries, for instance, or other injuries. So just understand your community, you know, and what is it that they do? What is it? How do they live with their circumstances? All those social determinants of health, as they apply in the context of their culture, is very important. So, you know, I know we've kind of touched on a little bit of everything. You know, the language, the specific pathologies, your social determinants of where do they live, what do they do for a living, what their diet is like, and then you know, work accordingly and tailor your care to your patients. So you know, it's a 360. It's not just one thing.
Right. And so basically what I've heard you all say is, as we care for our patients, we should see them as whole people, honor their cultural beliefs, the foods that they eat, how they celebrate, how they worship, and we should see them as individual rather than brushing a broad stroke and stereotyping. Because language and dialects of language can differ in the same region, in the same country, as well as thought processes and belief structures. Because same way, just being American, there's some of us who have religious beliefs, some of us who don't have religious beliefs, but our beliefs are so different. And so basically you're saying, honor the patient that's in front of you. And sometimes that gets hard for us to do, because I think we have, unfortunately, in American healthcare, have used both race and ethnicity as horrible proxies for health outcomes, for health thought processes. And we've done that rather than taking the time to be meaningful and engage with our patients and the communities that our patients exist in, and really understanding them and some of the barriers that they face. So I think that is a great reminder that we have to see people as individuals, how they show up, and not make these assumptions, because you know what they say about assuming. I don't like to look that way.
Absolutely, absolutely. And if I may add on what Brenda mentioned, in terms of your clinic and what you're doing medically, you know, we also have to remember selection bias, and a lot of the evidence-based medicine that we have many times has not included large representation of minorities like Puerto Ricans, like Mexicans, like Hispanics overall. So even that, we have to be open and conscious about how we're doing our prescribing, how we're kind of processing all that evidence-based, because that evidence-based many times not based in a lot of Hispanic representation samples.
Yeah, absolutely. And we might have to follow up with a part 2, just talking about evidence-based medicine, because I'm just like, whose evidence? But but we'll save that for another conversation. But definitely want to end our time, and I definitely want to honor your heritage, both being Puerto Rican, and we know that there are some very significant needs on the island of Puerto Rico. And as you alluded to, we do now have a PA program there, and they are advancing the profession from the ground up. And it is a heavy lift. So if you all could just share some of the challenges, both for the profession and from a healthcare perspective, that are our Puerto Rican fellow Puerto Ricans are exhibiting and what they're experiencing. And then what are some ways that we as PAs here on the mainland, how can we help? How can we assist? How can we raise the alarm as to what's going on to our fellow American citizens?
So like Brenda mentioned, clinically speaking, rates of asthma, diabetes, and a lot of other chronic medical conditions are higher in Puerto Rico. That would be on the clinic side. The other side, the systemic side, is the big issue in Puerto Rico at present is there's the availability of healthcare providers is extremely limited. We've had a lot of the providers that were in Puerto Rico have left the island for multiple reasons over the last 10 years. We've had a lot of crises, hurricanes, national debt, changes in government. Many things have happened that if we look at it, it has had multiple consequences at every level. But looking at healthcare, the way it has presented itself is we have a lack of providers. And it's alarming. It's not, we're talking about almost 50, the number doesn't come to my mind, but it's an incredibly high number of physicians that have left the island. Now, I say physicians because that's what basically a provider was in Puerto Rico for the last, until about 5 years ago when the law got passed that allows PAs to practice. And now we have the possibility of a different type of provider in Puerto Rico, which I think has a lot of potential to do good things and to improve the situation in terms of access. Yeah, Brenda, you want to add to that?
So I'd like, there's kind of, it's three-pronged, if you would allow me. The first issue that we need to highlight is the practice law itself for PAs on the island. It is a very restrictive practice law. It reminds me of when the mid-'80s, here in the States, where it was very regulatory, and there was a list of do's and don'ts, and more were the don'ts than the do's that we were allowed to do. So the law itself is in dire need of modernization and to expand and be able to have the full, be able to fully practice at the height of our license and our education. So, and we have a very strong lobbying group with La Academia de Médicos Asociados in Puerto Rico. That's our local academy, but also the American Academy of Physician Assistants and their caucus of physician assistants for Latino health. So, we're working very, very closely together. And there is a bill that has been put together, and now the efforts are trying to get support for the bill, which allow for a much broader, a much more substantive practice law. So we really, if you would allow me, Kara, to invite those who are listening, we need your help, we need your support, we need your voice. When you receive our email, please sign our petitions, call your local representatives, your national representatives in Washington, and bring that forth. And the more voices that we can get and the louder our voices become, the more likely this is to happen. Time is of essence. Every minute that goes by is more Puerto Ricans and children that are dying unnecessarily. Please, I invite you to, and if you have any questions, please reach out to the American Academy of Physician Assistants, the Physician Assistants for Latino Health, and the Academia de Médicos Asociados. If you're, please, your voice is needed, your support is needed. So that is in terms of the practice law. In terms of access, because there has been such an exodus of physicians from the island, many towns are left without any care at all. Just to give you an example, on the eastern coast of the island, which is closer to Vieques, there are only 4 gynecologists, obstetricians that are caring for pregnant women for the entire eastern coast, north to south. If you are a woman who goes into labor, the likelihood of you being attended, especially high risk, taken care of by a OBGYN, it's very risky, and a lot of women and babies we're losing them because they don't have access to that high level of care. The other thing is that not only the PAs have restricted license, but nurse midwives, for instance, are not even recognized in the States. They have an unofficial, they work unofficially, and they're called paiteras, but they don't have a license. Certified nurse midwives cannot even provide care under the law in Puerto Rico.
Wow.
So, and that's just a section of the island that I'm highlighting here. Personally, I can share the story of my aunt. She was diagnosed with colon cancer and had a resection of her bowel and had a colostomy. After surgery, she was sent home. She was 2 hours away from el Centro Médico, which is in Rio Piedras, in the city center. So she was 2 hours away. She had to go back for her 1-week checkup, to check the wound, check the colostomy, make sure she was healing well. They have no appointment system. It's first come, first serve. They left their home at 4 o'clock in the morning to be there at 6 o'clock in the morning. At 5 o'clock in the afternoon, the nurse comes out and tells everyone that the doctor's no longer seeing any more patients. And my aunt, who had traveled 2 hours, been there all day, 7 days post-op, has to go back home without being seen. So that, again, we can talk, it's the stories. These are the stories that the Puerto Rican community, the people are experiencing. I spoke of the eastern coast. On the western coast, there's only 4 pediatricians that are taking new patients on the entire western coast, from Mayagüez all the way down to Ponce. There's 4. So if you are a new mom who just gave birth to a baby and you're looking for a pediatrician, there's 4. They have to travel hours in order to see someone. So those are the realities. And, my goodness, over the last 50 years, our profession has shown how valuable we are here in the United States. We have a precedence, we have a history here. We need to bring that to Puerto Rico. And I'm very, very thankful for the 4 organizations, the APA, the PAEA, the NCCPA, and the ARCPA, who were present in our inaugural conference in Puerto Rico. And they vowed to support us and to provide even more support. So I'm very thankful for our 4 organizations, and look forward to the future with hope, that we're going to be able to be a presence that will make change, and to bring change to the island. You know, it's something that I feel very passionate about as a Puerto Rican, but as a human being. You know, it doesn't matter. As a human being, when you see a community like that that is literally dying, the mortality and the morbidity rates are 2.5 times higher than it is in any state. I think Mississippi may be the closest state to Puerto Rico in terms of that. And, you know, just as we advocate for the people of Mississippi, we're advocating for the people of Puerto Rico.
And Kara, if I might add briefly, I think when as a human, when Brenda says as a human being, I think this is a human rights type thing. Puerto Rico,
absolutely.
The people of Puerto Rico are U.S. citizens, but our territorial status creates a lot of difficulties and a lot of inequities in terms of how a lot of the laws that are applied in the states and in Puerto Rico are different for somewhat random reasons, if you want to call it random and not call it just discriminatory reasons. So when we talk about Hispanic Heritage Month, and Brenda talks about like being an ally and being a voice, Puerto Ricans don't have representation in Congress, not true representation. We have somewhat of a proxy representation, but we don't have a vote.
Mm-hmm.
So there's a lot of power from people in the mainland that call their local legislator and tell them, look, these are American citizens that are blatantly, in many cases, being treated very, very differently. I think Puerto Ricans need allies, and when I see the PA profession, and like Brenda said, when I saw all of you showing up to the island and caring about the things that are going there, that's what I wish every profession would do, because that's what we need.
Mm-hmm.
Yeah,
Mm-hmm.
absolutely. And I think just for context, you know, there are 3.2 million people that live on the island. And I think, you know, Brenda and Damien, to your points, these are fellow American citizens.
Mm-hmm.
These are
Mm-hmm.
fellow human beings. And to know that on one half of the island, there are 4 pediatricians available
Mm-hmm.
to care, right? You know, the fact that your aunt had to travel as far as she did and still wasn't able to be seen, knowing she's 7 days post-op, and for those
Mm-hmm.
of us that have done surgery or taken
Mm-hmm.
care of post-op patients, that would not be acceptable in
Mm-hmm.
any city on the mainland. So why do we make it acceptable for, again, fellow
Mm-hmm.
American citizens that are on the island of Puerto Rico? So I think the call to action has been made. As many of you have heard me say before, the practice of medicine is a political act. I'm not talking partisanship,
Mm-hmm.
but the fact that we are trained and have the knowledge to practice medicine, that is a political act. So let's use our political power to advocate for our fellow American citizens on the island of Puerto Rico. And so we'll have the information for the change.org petition. I'll definitely have that available. If you care about our fellow brothers and sisters of Hispanic ethnicity and want to lend your voice and support, and not only be an ally, but be a co-conspirator, right? Be a as someone said, be a comrade, right? And join. I'm gonna again highlight PAs for Latino Health. They are open to anyone to join as a member. I am thankful to them because I have sent students to apply to some of the several scholarships they have available. And so let's all be supportive because we are better together than we are apart. And when we honor and we see each other for the value and the cultural richness that we all can contribute, our profession will no doubt be around for another 50 years. So again, Dr. Damien Bedoya, Dr. Brenda Diaz, Thank you, thank you, thank you so much for your time, your energy, your effort, the hard work that you do, and how you are making our PA profession better. So thank you again for joining me today.
Thank you. Thank you.